The environment is very important in getting accurate blood pressure readings. I perform my blood pressure readings in one of my exam rooms so that I'm isolated from the other sounds of the hospital. My practice is a cat-only practice, so I don't have the sounds of dogs to contend with, but that is very important, that the sounds of dogs also be isolated from the area in which you're working. I prefer to have the owner present because the owner is the best person in the world to get this cat to calm down. So we like to have the owner so that she can put her hand on the cat so the cat is reassured by her presence. The equipment that we use, first we're going to lay the cat on this towel so that he's comfortable laying on the exam table. We'll need clippers in order to clip the hair, and then we need all the associated equipment with the blood pressure monitor itself. These are the headphones. I will wear those to keep the sound directed into my ears so the cat is not frightened by the sounds. This is the sphygmomanometer and the two cuffs that are usually appropriate for the feline patient. And as we'll see in a few minutes, the cuff's size is very critical, and these cuffs have marks on it to make it easy to determine the proper cuff size. This is the base unit, of course, and this is ultrasound coupling gel, which is used between the sensor and the skin in order to get a good airtight contact. One other important piece of equipment is a pre-moistened paper towel. When we finish with the procedure, we will use this to wipe the gel off the cat before we release him. What I want to show first is laying the cat down and determining cuff size. We begin by determining the proper cuff size. This blue mark is placed over the artery, and there's a little range mark that will determine whether or not the cuff is the appropriate size. If we put this one on this cat and wrap it around, you'll see that the range mark here does not include the blue mark. Therefore, this is a cuff that is too small for this cat. This cuff, on the other hand, when it's placed, you see that the range mark, which is here, does fall over the blue mark. Therefore, this is the appropriate size for this cat. This is attached to the sphygmomanometer. And now we will clip the hair. I prefer to do my blood pressure readings just above the rear foot. So we clip a patch of hair just above the main tarsal pad. Put on my earphones and plug this into the unit. Then we take the coupling gel, put a small amount on the area where we've clipped the hair, and this is the sensor that is placed right over the gel. Turn the machine on, and now I am immediately hearing the arterial sound. Because the headphones are plugged in, the cat cannot hear these sounds, but I'm going to take them loose so that you'll be able to hear what I am hearing. Now we're going to plug the headphones back in. I close the valve on the sphygmomanometer, pump up the cuff so that the sound is no longer heard. Then we release the valve and very slowly let off the air until the sound returns. And that point marks systolic pressure. I will do it another time or two to see if I'm getting consistent readings. And when I have 3 or 4 consistent readings, then I consider that an accurate systolic measurement. At this point, hold the button down for 2 seconds, and that turns the system off. We will take the sensor, taking care with it not to drop it, wipe the gel off the cat's leg, remove the cuff, and now we're completed. The readings that we take with the Doppler is only the systolic. Anything between 100 and 160 systolic is considered normal. Anything over 200 is considered abnormal. There is a gray zone between 160 and 200 in which often we see cats that are stressed achieve numbers in this range, and so we normally discount a 180 or 190, especially if there's any degree of stress in the cat at the time the readings are made. I'm Dr. Gary D. Norsworthy of Alamo Feline Health Center in San Antonio, Texas. I'm going to talk to you today about an overview of hypertension and the use of the VetDop to detect and monitor blood pressure in cats and dogs. Measuring blood pressure is a routine procedure in human medicine because it is easy to perform and because systemic hypertension is a major disease of humans. Systemic hypertension is also a significant clinical disease of cats and dogs. It is a primary disease in a small number of cases. However, its most common presentation is as a secondary complication to several conditions. It is found in many dogs with chronic renal failure or hyperadrenocorticoidism. It is commonly found in cats with chronic renal failure and hyperthyroidism. It is present in over 50% of cats with renal disease and over 30% of cats with hyperthyroidism, making it a significant complication that needs to be detected and treated. If you're not able to make blood pressure determinations, you will not be able to diagnose and treat systemic hypertension in cats and dogs. Use of the VetDop gives you the ability to find this important disease. This is Bart, a 16-year-old domestic shorthair that was presented by Mrs. Roberts, his frantic owner. Bart appeared to be normal the previous day, but suddenly began running into furniture. Mrs. Roberts reported that Bart appeared confused and panicked. It was obvious to Mrs. Roberts that Bart suddenly became blind. An examination of Bart's retinas revealed dark areas on which the ophthalmoscope could not focus. This is his left retina. Note the dark area from 11 o'clock to 3 o'clock. This is retinal detachment, the most dramatic and debilitating result of hypertension in cats. With rapid diagnosis and treatment with hypotensive drugs, many of these cats will regain much of their sight. If you only look for hypertension when cats are presented with retinal hemorrhage or detachment, you will miss many hypertensive cats. There are several other important manifestations that have nothing to do with the retinas. Anisocoria may occur when one retina detaches and the other does not, or when retinal hemorrhage occurs in both, but the amount of hemorrhage is considerably more in one eye. Cats with massive retinal hemorrhage have been noted to have hyphema. Strokes may occur in hypertensive cats when distended arteries in the brain rupture. This is known as hypertensive encephalopathy. A similar occurrence may result in seizures. Therefore, cats with stroke-like signs or seizures should have their blood pressure determined. Gallop rhythms and heart murmurs are often associated with hypertension in cats. These are often due to the effects of left ventricular hypertrophy associated with hypertension. Finally, epistaxis may occur in hypertensive cats when small arteries associated with the turbinate bones rupture. We typically think of determining blood pressure in cats undergoing anesthesia and surgery, or having one of the manifestations of hypertension. However, there are some other indications for blood pressure determination. Cats are often presented with an acute onset of paralysis of the pelvic limbs. We know that spinal disease and vascular disease can cause posterior paralysis. A saddle thrombus is the typical vascular lesion commonly occurring in cats with cardiomyopathy. One of the rapid ways to diagnose saddle thrombus is by determining the blood pressure of the pelvic limbs. If it is normal in both feet, vascular obstruction can be ruled out. Trauma is common to feline and canine patients. This cat was presented with severe trauma to the left rear leg. The trauma was so great that we considered a recommendation for amputation, fearing that circulation had been impaired to the lower part of the leg. However, a blood pressure reading was made near the foot. It was normal, indicating adequate circulation to the lower part of the limb. Amputation was not performed, and the cat recovered the use of its leg. We have mentioned diseases that commonly accompany hypertension. These include hyperthyroidism in cats, chronic renal insufficiency or failure in dogs or cats, and hyperadrenocorticism in dogs. You should perform a blood pressure determination when you diagnose any of these diseases. Failure to treat hypertension can result in severe secondary complications to these patients. It is also notable that the administration of erythropoietin, such as Epigen, for treating anemia secondary to renal disease can aggravate hypertension. Hypertension is a contraindication for the use of this drug. Many owners are very willing to have preemptive tests performed on their older cats and dogs. Your geriatric profiles should include a blood pressure determination. The VetDop was not designed as a surgical monitor. However, it can be used for that purpose. It permits periodic blood pressure determinations by your technician and can serve as an audible means of monitoring the pulse rate by listening to the recurrent swish, swish of blood flow. Obtaining accurate blood pressure readings is a two-step process. First, we must create a setting that will not cause undue stress and a false elevation in the blood pressure. Second, we must learn to use the equipment efficiently. Cats have a number of physiologic responses to stress. Their blood glucose elevates, sometimes to as much as 350 milligrams per deciliter. Their leukocyte increases to as much as 20,000, and their blood pressure rises dramatically. The latter is often called the white coat effect, common in humans and cats. This paper documents this phenomenon in cats. It was published in the Journal of Veterinary Internal Medicine in the March-April 1999 edition. In order to get an accurate blood pressure determination, you should do the following. Place the cat in a quiet room, preferably a small, non-threatening room such as an exam room. The cat needs to be away from the sights, sounds, and smells of other animals, especially dogs. I perform my blood pressure readings with the cat in lateral recumbency. Place the cat on a towel or other padded surface. The cat's owner is the one person who has the best chance of calming the cat and taking away stress. If at all possible, have the owner present, touching and speaking to the cat. Only perform gentle restraint. Take the blood pressure reading before doing other parts of the physical exam, if at all possible. Taking blood and urine samples and inserting a thermometer can cause elevations in blood pressure. Finally, be flexible and creative. Leaving the cat in its carrier can be stress relieving. I've even gone to the car of the owner so I could get a good blood pressure reading. Sending home the blood pressure equipment for the owner to use should be considered for some situations. Avoiding the white coat effect can require thinking out of the box. This is the VetDop by VMed. It consists of 1. The base unit, 2. The sensor, 3. The sphygmomanometer and pressure cuff number 4, 5. The headphones, and 6. Coupling gel. Assemble the equipment. You will need hair clippers, the VetDop, and a wet paper towel. Choose the site for blood pressure determination. The front leg, rear leg, or base of the tail may be used. There tends to be some variation between these sites, so it is best to be consistent. If you use the rear leg, as I do, use the rear leg on all of your patients and on all subsequent readings in the future. The cat needs to be positioned on the table or whatever location you are using. Be gentle and encourage the owner to continue interacting with the cat. Clip the hair from the chosen site. Set up the equipment. Plug the end of the sensor wire into the rear of the base unit. Put on the headphones and plug them into the base unit. Apply the pressure cuff to the leg or tail. There is a blue line printed on the cuffs supplied with the VetDop. This blue line should be positioned over the intended artery. The cuff should be about 40% of the diameter of the chosen site and applied snugly. To aid you in determining this, there is a circumference range printed on each cuff. When the cuff is wrapped around the limb, the blue line will fall within the range guide if it is the correct size. The chosen cuff is too large if the blue line falls outside the small end of the range, and too small if it falls outside the large end of the range. Apply coupling gel over the site of the artery. Turn on the VetDop by pressing the on-off button. Note that holding the button down for 2 seconds, as is done to turn it off, will cause the unit to malfunction. Grasp the sphygmomanometer with your dominant hand and position the sensor over the artery distal to the pressure cuff. Move the sensor slowly until the arterial swishing sound is clearly heard. Hold it in place with your thumb. If you lose the sound, reposition the sensor until it is found again. Inflate the cuff slowly. Very rapid inflation can startle the cat and result in struggling and blood pressure elevation. Continue inflating the cuff until the swishing sound stops. Now the pressure in the cuff has exceeded the systolic arterial pressure. Deflate the cuff slowly by turning the knob on the sphygmomanometer. The arterial swishing sound will return when the pressure in the cuff is below the systolic arterial pressure. Note that point on the dial and record it as the systolic pressure. Repeat the procedure 4 times. There should be at least 1-minute intervals between the pressure readings. Inflating the cuff too many times or at rapid intervals results in arterial fatigue. This means that the artery does not rebound from previous readings. Falsely lowered readings result. Record all 5 readings. If they are reasonably close, average them and consider that the systolic pressure in millimeters of mercury. If they are not reasonably close, perform 2 more readings. Discard the high and the low readings and average the 5 remaining. This number is considered the systolic pressure. The procedure is now concluded. Turn off the VetDop by holding down the red on-off button about 2 seconds. Use the wet paper towel to wipe the coupling gel off the cat's skin. Rinse the sensor in cool water to remove the coupling gel from it. Repack the equipment so it is ready for your next patient.